So you've probably determined that your hair loss is progressing enough that no matter what you do with the non-surgical treatments, it's not going to get you the hairline or the head of hair that you want. So at this point, your only option is going to be surgical hair transplant. Now, I wanted to give you some of the basics of the philosophy behind the process and also go into some of the history in this video. So the entire premise of a modern hair transplant is that for some reason we never lose hair on the back and sides of your head. Even famous bald people like Michael Jordan had hair on the back and the sides. Now, that being said, if you are losing hair in those areas, you probably need a biopsy of your scalp to determine what's causing that hair loss. Things that are related to your immune system or something like a scarring alopecia can be causing that. And though there's no great treatment for that, you don't want to undergo a hair transplant if that's the type of hair loss you have, because it won't work and those hairs will fall out. Now, historically, hair transplants were first done with a bigger surgery. The initial hair transplant surgery was something called a jury flap, when an entire area of the head which had hair was rotated and turned and a new area of hair was created. This basically was reducing the area of the scalp in order to appear like there was more hair. There still are similar surgeries done to this day. One particular one being a forehead reduction, where an incision is made into the forehead, some of the skin is removed, and we reduce the size of the forehead, but by doing that we give the appearance of actually enlarging the area of hair that's there. Now, when it comes to the modern day hair transplant, there's two techniques, which there's a video on that, and those are going to be the follicular unit extraction versus the follicular unit transplant. The variation in techniques is simply the method in which the hairs from the donor area or the back and the sides are removed, and all of them share the similarity in that the hairs are implanted in a similar way. A special tool is used to make punctures in the areas you want to place the hairs, and then those hair follicles, which could contain anywhere from 1 to 4 hairs, are implanted into those puncture sites, similar to the way one would plant corn. Over time, the hair falls out, but the follicle remains in place. And once the follicle embeds into your scalp, new hairs grow out. This process takes at least 6 months, and you will see the final result at up to 18 months. So it is a process that requires patience. Below, you're going to find some videos explaining the specific differences in types of hair transplants and things that can go wrong and right in hair transplant.